How to get rid of a runny nose. Runny noses are always a bother. Read this article to learn how to treat a temporary runny nose and prevent a bloody nose. If you're experiencing other symptoms in addition to your runny nose, like a fever, cough, and/or sore throat, or if you have a chronically runny nose, then see your doctor to treat the underlying medical cause. Determine the reason why you have a runny nose to get the most effective treatment. If you understand why your nose is leaky, you can suit your response for effective treatment. Basic causes of runny noses, and potential cures, include allergies, taken over-the-counter antihistamine. Cold/sickness, manage symptoms with steam and decongestants. See a doctor if symptoms worsen or last longer than 48 hours. Clogging, blow your nose and try and clear the irritant. Stress, lifestyle choices, get plenty of sleep and relax for a night. Manage symptoms until gone. Clean out your nose regularly. When your nose is runny, blow it through. The best way to handle a runny nose is to remove the fluid. If you do not manage to get the irritant out of your nostrils, try a Netipod, detailed below, or other nasal irrigation product. Gently massage your nose, between your eyes, and earlobes to ease sinus pressure. These points on your body can be used to relax your sinuses, helping slow down the flow of a runny nose. Apply light pressure to each nostril, closing and opening them slowly. Then rub above your eyes and on your earlobes to complete the technique. You can use a washcloth soaked in warm water for even better results. Use steam to ease discomfort. This will help reduce the mucus that are produced by runny noses. You can also take a hot shower or bath, turn on a humidifier, or lean over a bowl of hot water. Add eucalyptus oil, camphor spirit, peppermint oil or soda for an extra kick. Try medication and supplements to further manage symptoms. There are a variety of prescription and over-the-counter sprays, pills, and creams to help manage your runny nose, including nasal sprays, preferably those containing ilepatidine, prescription only. Vapor rubs and topical decongestants. Magnesium, 400 mg, and/or zinc, 15 mg, supplements can help open up your cells and nasal passageway. Apply pressure. Press down 10 times on the corner of your nose, pressure very gently to keep your nose from getting worse. It is believed that this pressure point can help alleviate sinus congestion and headaches that result from colds and allergies. Your nose should be almost closed each time you apply pressure to the area. Repeat on the area just above your eyes, applying mild pressure. Repeat 10 times on each side of your face. Irrigate. Use salt water to flush out the nasal passages, freeing up mucus and other debris. You can either use a syringe, Netipod, or other product designed for nasal irrigation. The first thing to stop or prevent a runny nose is to irrigate and remove pollen, dust or pus from nasal passages. Use distilled water with a Netipod and sinus rinse that washes salt water in one nostril and it comes out the other nostril. The rinse is approximately 240 milliliters of distilled water with mixed salt and baking soda to pH balance for comfort. Runny noses can irritate mucus and cause a bloody nose. This rinse can dry out mucus and might lead to epistaxis, bloody noses. To moisturize the nose, a half teaspoon of glycerin 99.5% anhydrous from the first aid department of a pharmacy can also be added to the nasal rinse. Glycerin is moisturizing and forms a barrier so pollen and dust will not come in contact with mucous membranes. A saltwater nasal rinse also helps a bloody nose to stop bleeding. Be careful not to inhale the water. Blow your nose. Runny noses result when you have excess mucus and fluid buildup in your nose and throat. The best way to treat a runny nose is to get the excess fluid out. Blow your nose gently, using a soft tissue to avoid skin irritation. Don't blow too often, as it could cause skin burning and redness. Apply a warm compress. Soak a hand towel in hot water and place it on your face. This will help alleviate sinus pressure and open up the nasal passages. Roll the piece into a tiny ball. It should be about the size of your nostril. Gently place the tissue inside your nostril. Repeat on the other side, using the other half of the tissue. Relax and breathe normally. The tissue will help absorb some of the fluid coming out of your nose without you having to constantly blow. Breathe through your mouth if you are having issues getting enough air. Rub a small amount underneath your nose. You can also apply the Vicks to your chest area. Take deep inhalations, and your runny nose should be gone in no time. This method also helps get rid of a stuffy or congested nose. Get a big bowl, and boil some water. When you get the boiled water into the bowl, put your head in the bowl, just don't touch the water, and put a towel over your head. Home remedies include breathing a steam bath of eucalyptus oil, camphor spirit, or peppermint oil. Put your head under the towel for about 2-3 minutes. Try prescription medications. The options include ilopadidine nasal spray and ipratropium nasal spray. Ilopadidine is a mast cell stabilizer and antihistamine at the H1 receptor. Ipratropium bromide is an anticholinergic agent chemically similar to atropine. Ipratropium bromide has long been used as an inhaler to treat lung disease, and it was serendipitously found to cause dry noses. Irrigate and allow time for nasal passages to dry, usually 15 minutes, before using medicated nasal sprays. Try magnesium and zinc pills. Magnesium 400 mg supplement oral pills can help blood vessels dilate and restore blood vessel responsiveness in the mucus-producing glands. Oral zinc 15 mg supplements can also benefit intracellular pathways that cause secretions like mucus. Identify the cause of your runny nose. There are a number of potential causes, including common colds, flus, allergies, cold weather, stress, exposure to tobacco smoke, chickenpox, and whooping cough. If you are experiencing other symptoms in addition to a runny nose, like a fever or sore throat, then see your doctor to determine whether you have a bacterial or viral infection that requires medical treatment. Common colds usually go away on their own, but should be treated with fluids like water and fruit juice, lots of rest, and soothing foods like soup. Avoid nasal irritants. Runny noses can be caused by allergies to pollen, pets, latex, dust mites, and foods. If you are in constant contact with an animal, plant, or material that you are allergic to, you will probably experience runny noses often. If you live with a pet that you are allergic to, you should consider either getting rid of the pet, moving, or taking allergy medication. Thoroughly clean your home to remove dust mites, and stay away from food and plants that you are allergic to. Runny noses can also be caused by excessively dry or cold weather. Try using a humidifier to restore some of the moisture in the air in your home. Humidify the air and warm the air to keep nasal passages comfortable. Dry cold air can insult the mucous membranes and cause rhinitis. Dry nasal passages can become irritated and will be more likely to become infected and bleed.